Hello, everyone. Good evening. Hello. So, welcome to our Facebook Live tonight. This is Mr. Allen. I would like to find out, can everybody hear me, everyone, in our Facebook Live tonight? Yes or no? You can send a message in the comment section. Um, anyway, thank you for being here, everyone. So, for tonight, we're going to have a Facebook Live, a quick session on discussing next gen the next generation NCLEX, especially the most important aspects that you need to know about these changes in the licensure examination. So I'll be presenting the different changes, and also there will be no practice questions tonight. It's going to happen in the next few days or weeks. But for tonight, we'll just cover everything about the next generation NCLEX. So if you are all ready, everyone, can you click OK so that we can present what next generation NCLEX is all about? Okay, so can you please post in the comment section, everybody, where you're coming from, where you're calling, or where you are joining from, like what state? I know that we have a few people joining right now, so we'll try to do this more often in the next few weeks, especially practice questions for the next generation and class everybody. Okay. Also, I'll be making an announcement. Especially our discount sale coming up for the Cinco de Mayo, and at the same time, our my book, the new edition, is gonna come out soon. So I'm gonna be giving you an idea what it is all about as well. Now, before anything else, without further ado, I would like to introduce myself. My name is Mr. Alan Matus. I am a nurse educator. I have been teaching NCLEX and teaching students in the nursing program for so many years, and I like what I do. And I have helped a lot of students pass their licensure examination. So hopefully, everybody, you will learn something tonight to decrease your anxiety and your fears on what the next generation NCLEX is all about. And you'll be surprised that it is not as hard as it seems to be. Okay, it's just really one of those examinations that you need to get adjusted with. And once you are able to adjust with different types of questions, then it becomes much easier. But of course, these types of questions really will test your critical thinking or your clinical judgment, everyone. So I would like to welcome, hi Annie Turbio. We have our student. Hi, Annie. So, family picture, very nice. We have Nora Cornelison tonight, also. Very nice picture there. Then we also have Hi, Joe. One of our students is Joe in the online academy. So, thank you for being here also tonight. Who else do we have tonight here? So, we have Kay, Dait, Nora. Okay. So, thank you for being here. And then also Arlene Henry as well. Special shout out to you. And she's coming from Jamaica. All right. So let's go to our different introductions or slides first before we discuss your next generation NCLEX. So you all know that I am an author of an NCLEX review book. The Simple, Fast, and Easy NCLEX review book is available in Amazon. And the new edition is coming up, and it's going to include questions on the next generation NCLEX. Not really questions, but concepts with next generation tips. The book itself right now is really complete with all the content that you need for the NCLEX or licensure examination. Okay, so it's a content review. If you want a quick way to review for the NCLEX, then this is for you. The simple, fast, and easy NCLEX review book that I have in Amazon, everyone. Okay. All right, so another one, we have extended this promo. You pass your NCLEX in 30 days. I have my workbook online. You you can purchase that in our NCLEX Academy, or I will share also the link in the comment section as well. We have extended our promo. So if you buy the workbook, which is 99.50, you're going to get a 3 month online access review for the self study. So the self study alone is going to be $139. Okay. However, if you buy the workbook, we will give you for free the 3 month access. So if you're planning to review for the NCLEX soon, and then you have a short time, and you really want to solidify your content review, then this is the material for you guys. It's 400 pages of workbook, and we're going to ship them to you directly in the United States. If it's international, of course, there will be additional fees. But if it's within the US and the Philippines, it's going to be free shipping only. So for 99.50 only, guys, this is a good deal, and it's not going to last soon because we have only a limited number of workbooks. So make sure that this is extended until May 15. So make sure that you order if you want to, because we only have limited numbers of this workbook. Okay. And this is something that a lot of our students like. So it's a promo right now, which is 99.50. Okay. Um, Another one, of course, we have the live webinars. So we have ongoing live webinars right now. Our live webinar is every Saturday. That's from 8 to 4:30 p.m. And we started 2 weeks ago. So we're now on day 3 tomorrow for the live webinar. So we're going to end in June 24. However, if you're unable to attend our live webinar every Saturday right now, you can actually also have the option of the self-study online NCLEX review course. So especially if you're a very busy person and you want to have an organized plan or format wherein you can sit down and listen and watch the videos. So the main advantage of the self-study comprehensive online NCLEX review is the fact that it's very organized. I'm a nurse educator, so I arrange the topics in such a way that it will be very easy for you to review your concepts. Okay. So, and then also it comes with a workbook as well, and you have different options if you want to have a if you want to have a let's say a 6 month review or a 1 year review or a 3 month review. You have all those options, everyone. Okay. All right. So let's go to the next, everyone. Now, we have our learning objectives for tonight. So our learning objectives for tonight, everyone, will be number one is the purpose of the next generation NCLEX. So what is this next generation NCLEX? Why did the National Council for State Boards of Nursing change the format of the licensure examination? What is the need for that? We're going to define a little bit about what clinical judgment is. So the most popular terminology that we have in the NCLEX right now is the terminology which is clinical judgment. We used to call this your critical thinking, but now we use more commonly now your clinical judgment. Another one is we have the 6 cognitive levels that you will be tested on in the NCLEX according to the NCSBN clinical judgment measurement model. So there's 6 cognitive levels, or let's say skills, that you'll be tested on in the NCLEX, and we will be discussing that. Um, Also, very important, everybody, will be the types of the NGN question formats, everyone. So what are the questions, the types of NGN question formats that you need to know? The scoring rules are very important as well for you to know. And then the design of the next generation NCLEX exam. So how many questions are there going to be? How many unscored items? And how many hours is the examination? Also, you will have the preparation tips for NGN questions. Preparation tips. I'll be giving you some tips, or strategies. Although I really discuss a lot of tips when I do the review program. And also, my book will cover some tips for the NGN questions. And also some resources where you could get some more information about your next generation NCLEX. So basically, tonight is just really touching over the basics about your next generation NCLEX, especially if you're a student who's really a little bit afraid or worried about this next generation NCLEX. So let's go to the next one. We have so when did NCLEX changed? NCLEX changed last April 1, 2023. So it's now May, and it's almost 30 days that more than 30 days that students took the NCLEX. I was reading the NCSBN earlier today in their Facebook page, and they said almost 15,000 students already took the NCLEX examination using the next generation format. Um, I'm not sure if that's really accurate, but so far, thousands of students already took the next gen. And then also, of course, what is next generation NCLEX? Now, your next generation NCLEX uses new types of questions to better measure clinical judgment. Clinical judgment is almost similar to critical thinking. It means to say that if something's going on with your patient, you undergo through a process of thinking to really find out what's going on with your patient and then make decisions and evaluate if those decisions and interventions are working or not. So that's your clinical judgment. So really trying to find out what's going on with the patient and make decisions and decide and take action or interventions. The NGN exam asks better questions to help nurses think critically when providing care and make the right decisions. The NGN is about protecting the public and achieving the best outcomes for clients, nurses, and institutions. So you have to remember that at the end of the day, the licensure examination is all about protecting public safety. And that's the reason why the licensure examination has changed because it has to answer the call of the times. Our patients are becoming more complex, they're becoming more sick. And the reality is, our patients have a change in condition. It could either be slowly or suddenly. And we need nurses who will be able to think critically and have the clinical judgment to take actions and promote patient care and safety. This is a very important slide, everyone. The cognitive levels that you'll be tested on in the with the next generation NCLEX format. So these six cognitive levels, if you can remember, or if you've heard somewhere else, you will have case studies in the next generation NCLEX. And you will have three case studies with six questions each. So these six questions with the case study starts with recognizing cues. So you'll be tested on how you recognize cues or changes in your patient, and then followed by analyzing the cues and prioritizing your hypothesis, and then generating solutions, take actions, and evaluating outcomes. So it's very interesting that the clinical judgment model starts with your recognizing the cues and then taking actions and then the evaluation, so the questions that you will receive will be testing you this. So for example, the first question in the case study, because you have six, right? So the first question will be about asking you what are the abnormal findings that need to be reported. And then when you talk about generating solutions or taking actions, you will receive questions about, so what are your interventions, planned interventions, and interventions that you will take. And lastly, you have evaluating outcomes. So evaluating outcomes is a question wherein it's going to be asking you if your patient is improving or is your patient worsening. So basically, all this, they are sequential. So you start with recognizing cues and then you end with evaluating outcomes. So these are the cognitive levels. So take a look at this slide, guys. Master this because these are the questions that you will receive in terms of the next generation NCLEX. The competencies that you need to be able to show, that you are having the ability to recognize cues, analyze cues, prioritize hypotheses, generate solutions, take actions, and also evaluating outcomes. Okay, so how will clinical judgment be measured? So we have, of course, we have case studies, like what I have said. Your case studies are real world nursing scenarios accompanied by multiple test items. So you have three case studies with six questions. And then you also have standalone items, which are individual items that address one or more steps of the NCSP clinical judgment measurement model that are not part of the unfolding case studies. So the bottom line is you can receive three case studies with six questions each, and then also after that you will receive here and there some individual NGN questions, which are also case studies, but they are individual. Only one case study with one question only. So what are the scoring models for next generation NCLEX? You have three scoring models. You don't need to memorize these scoring models, but I would advise that just be familiar with them so that when you answer the question, you know how you will be scored. So the most common, or let's say what you're familiar with, is the 0-1 scoring. The 0-1 scoring is the scoring wherein you will earn 1 point for any correct answer. So meaning in the 0-1 scoring, we will just count your correct items. In the plus minus scoring, which is the second one, that's the correct minus wrong. Is when they penalize you for marking the wrong answers. So that's correct minus wrong. Okay. And lastly, you have the rational scoring, which I will also explain. The rational scoring is when you have paired information, and it's very important that you provide the correct answers to both in order to get a point. So just remember at this time that you have three scoring models for NGN: 0-1, the plus minus, and the rational scoring also. All right, so let's proceed to the 0-1 scoring. Just kind of like give you an example. The 0-1 scoring is the scoring we're in. You will earn a point for marking the correct answer. So for example, this is the question. So this is a multiple response or select all that apply, select in. So meaning when you say select in, it's a select all that apply, but you know, it's a selection, but you're only allowed to select, like, for example, 4 or 5. So in this question, select 4 findings that require immediate follow-up. So the example is the person marked 3 correct, but 1 is wrong. So out of those 3 and 1 is wrong, there's no penalty because this is a 0-1 scoring. So out of those 4 that supposedly are correct, he marked 1 that is incorrect. So he only got 3 correct. So that would be 3 points only. So there's no penalty. So this is not a correct minus wrong. Okay. Now the other scoring that's really new is the correct minus wrong scoring. And the correct minus wrong scoring means that if you mark a wrong option, then that will be deducted from the correct options. So for example, this one is a select all that apply, and the person answered 3 correctly, but then there's one that is wrong. Then 3 minus 1, the score of the person is only 2. No. Now, I tell students that one way to find out or to have an idea, listen everyone, that a question is a correct minus wrong question is if the question allows you to check almost everything or unlimited answers, they can almost check everything, more likely that is a correct minus wrong question. Again, I will repeat. If the question allows you to click as many as you can, no limits, or you can even check everything. So any question with that kind of option that you can just click anything on everything, more likely that would be a correct minus wrong. So make sure that you don't click everything because there will be deductions from the ones that you click wrong. Did you understand, everyone? Was that very helpful? You can make a comment in this section, everyone. So be careful with the correct minus wrong, everybody. Okay. Now, lastly is going to be the rational scoring. The rational scoring is a kind of scoring we're in. It's a cause and effect relationship. It's paired information. It's a sentence and then there's two blank statements and you have to make sure that your answer for the first one should be correct and the second one should also be correct. So if one is wrong, then everything is wrong. So what is an example of rational scoring? Rational scoring means that there's a relationship between the two questions. So for example, the client is at highest risk of developing blank as manifested by blank. So meaning that there's a relationship. Because as nurses, if we're thinking of a complication, our rationale must be correct. So you only get the question right if your rationale is correct. Okay? So there's some questions that you also have a drop down, but they are not rational scoring. You know, you have drop down, but then they're not related. So that's not rational scoring. If it's a rational scoring, it means that you need to get both correct in order to get the point. So can you click yes in the chat box if you understood what I said? So any questions that said the client is developing this because of this, then that's a rational scoring, meaning that both of them should be correct, everyone, okay? Or the client needs this intervention because of this, then that's a rational scoring, so you have to make sure that you get both right. So that was a quick review of the scoring rules for the next generation question. Okay, so let's go over some NGN question types. It might overwhelm you that we have a lot of types, for NGN. So we have the extended multiple response. The extended multiple response is basically the select all that apply question. But remember, as I have shown you, there are some select questions wherein you select 4, you select 5. There's some questions wherein you select all that apply. Be very careful with select all that apply because that allows you to click as much as you can, and the scoring for that is correct minus wrong. So be very careful with that. Okay, you have the matrix or the grid. You have the drag and drop, the drop down, the highlighting, the bow tie, and then the trend. So I will give you some examples of this. I would say that one of the best ways to be familiar with the next generation NCLEX is to be familiar with the questions. And the best way basically is to keep on practicing. Okay? Thank you, Arlene. So let's go to the standalone types. For the standalone types, these are the types of questions. So number one is you have your drag and drop or close. So in this kind of question, you have a question and then you have the options, and all you have to do is to drag and then drop that. That's it. Okay. Another one is you have the drop down close. So this is a close question. However, when you click select, then you can see the options. So that would be drop down close, everyone. Another one is this is a drop down rational. So in the drop down rational, what you have will be, again, the scoring for this will be correct minus wrong. Okay. So be very careful with this because this is a question where you need to get both questions right. This is the matrix, and in this matrix, you have nursing interventions, for example, and then you have to identify if it's indicated or not indicated. Now, in this question, this is not a correct minus wrong because you're only allowed to click either indicated or not indicated. Okay, so this is not a correct minus wrong ruling here. Then you have the extended multiple response matrix. Um, this kind of question allows you to click as many as you can. So be very careful with this kind of question because you might end up, this is the correct minus wrong. Okay. So be careful what you check in these boxes. You have almost 15 boxes there. So be very careful because this is correct minus wrong ruling. Okay. Then you have your select all that apply, which is really the one that you're very familiar with. With the select all that apply, you can mark all seven if you want. But just again, be very careful. If the question allows you to mark as many as you can or even everything, that's a correct minus wrong. So be very careful with this, everybody. Okay? And also, I would just like to give you an idea, a tip, in a select all that apply, and this is correct minus wrong, it's almost impossible to have everything or all the answers correct, just to let you know that. Okay? It's going to be very rare or almost impossible for them to have all seven correct because it's a correct minus wrong question. So just be aware of that. Okay? Next, you have the enhanced hotspot or highlight. So basically what's going to happen is they're going to give you the text and then they will ask you, for example, what's the priority or what's the abnormal issues. And what you can do is you can just highlight, okay? You might be asking me like, but what about Sir Alan if I forget one word? No, when you highlight this option, it's automatic that it's tokenized, meaning that when you click one word, it kind of like highlights the other words. Okay, so that's enhanced hotspot or highlighting. And of course, this one, okay, you have your bow tie. The bow tie is a question that looks like a bow tie, okay? And the way you answer this question, everyone, is you can see in the middle, you have to drag and drop your answer here. So what you can see here will be in the middle, you have to identify in the middle, you have to identify the disease condition. So you're going to drug that. And then on the left side, you have to take two actions. And then on the other two sides, you have to choose the parameters. So when you're answering a bow tie, what I would say is that you really need to have the correct condition, the one that you think is going on with your patient. So, for example, in the situation, let's say Bell's palsy is the answer. Then you have two interventions and then you have two parameters to monitor. So, meaning you really have to choose the right condition. What do you think is going on with your patient? And then what's your two interventions and your two parameters to monitor? Okay. So, that's all about the types of NGN questions and the formats. Now, let's go to the NCLEX test design before we end. So the NCLEX test design, still you have 85 questions now for the NCLEX, 85 minimum, and then 150 maximum questions. You have 15 non-scored questions. So which means to say that if you finish the whole 150, you are scored only around 135. And if you finish at 85, you actually got scored only for the 60 questions or the 70 questions. So if you stop, for example, at 125 minus 15, only 110 has been scored. Okay. And you have 5 hours. I always tell students, time is not your enemy in the NCLEX, so take your time. Okay, take your time. And you will have 3 NGN case studies with 6 questions each. So you call that the unfolding case study. 3 NGN case studies with 6 questions each. The total will be 18 because 6 times 3 times 3, that will be 18. Okay, so which will be given before the first 85 questions. So by the time you end your 85 questions, you should have answered the 18 questions from the 3 case studies, guys. Okay, And then after 85, if the computer didn't stop, you will still receive individual case studies or standalone case studies, around 6 or 7, depending if you finish the whole 150 items. Okay, so you will see that the NCLEX exam right now, the next generation NCLEX, has not totally changed, guys. It has not totally changed, you know. So out of 150, you just really have 18 case studies from the unfolding case studies. See, 18 questions from the unfolding case studies. The rest of the questions that you will receive from the NCLEX are still the classic or traditional NCLEX before. So you still really have to study your prioritization delegation. You still have to study your infection control. So you still have the traditional NCLEX mostly in the NCLEX. I would say that the NCLEX changed only for, let's say, 10% or 15%. It didn't change 100%. Okay? Only a small change. Only the addition of the case studies. So your concerns are valid that these case studies are challenging, but just remember that the NCLEX has not totally changed. Okay? And the good news is in the NCLEX, you will still receive partial credit points for some question types. So meaning to say, the good thing about the NCLEX is that even if you're wrong and select all that apply, you will still receive partial credit. So before, in the old NCLEX, when you miss an option in the select all that apply question, everything is wrong. But now, whenever you put answers on your select all that apply option, for example, in the next generation NCLEX, you receive partial scoring, which is good. Okay? All right. So now the question, everyone, is okay, our question is, what are your strategies? Okay, but before that, let's have your resources. Now, the number one advice that I will tell you is this, and this is what I tell all students. Visit nclex.com, which is the number one resource, the main resource for next generation NCLEX. And I want you to download the following: the NCSBN case studies. Download it, it's free. They will give you sample case studies. Look at it and be familiar. And the exam preview, download number two, very important. The exam preview is a document that shows you how the exam looks like, how the questions look like, and how the case studies look like in an examination. So do that because that will give you an idea of how really NCLEX looks like. Promise me, everyone. Click yes in the chat box, everybody, if you heard me about that. So have you downloaded these free materials from NCLEX? Okay. So be familiar with the exam by downloading the exam preview and also your NCSBN case studies as well, the sample. Okay. And lastly, your question will be about the preparation tips for NGN. There's a lot of tips that I want to give you, everyone, but I'm gonna give them to you as we go through the different Facebook Live that we have. We're gonna have some practice questions soon, so we're gonna be doing Facebook Live and that as well. And in my Facebook group, I have been posting NGN tips. My new book is going to have some NGN tips, but let's have some of the most basic tips for now. Number one is know the type of question formats and scoring. So be familiar what are some of the formats of the question as what I've said. Watch this webinar again and then look at the sample questions, or the sample case studies that they're giving you. And be familiar with the scoring. Review the sample case studies from the NCSBN, like what I have said. So download them from nclex.com. Practice answering NGN questions. So there's Q banks available now. You can answer NGN questions from those Q banks. Okay, I'm not gonna mention them, but you have Q banks. But before you go to the Q banks and answer NGN questions, Download the free document or material from NCLEX.com. In the NGN, you will have case studies, and case studies will not tell you what's going on with your patient. You have to figure it out, recognize the cues. So always make sure that you master the signs and symptoms of diseases. What are the labs? Because these are the things that you will see when you have a case study. Master the signs and symptoms, especially presenting symptoms and the relationship with labs and diagnostic tests. Okay? And of course, you should know how to interpret laboratory test results because your labs always goes together with signs and symptoms. And if you know what's going on with your patient, then you know what to do. Am I right? So in the NCLEX, they are not going to tell you. They will not tell you. They will not tell you if your patient is having a sepsis, if your patient is having autonomic dysreflection, if your patient is having a ruptured appendix. No, they're not going to tell you. You have to figure it out yourself. Okay? So again, hopefully everyone you learned something tonight. This is a quick orientation only about the NCLEX. So it's a quick one, but hopefully that you learned something about your next generation NCLEX, everybody. Okay, and of course, in the next few weeks, I will see you again because I'm gonna be having a Facebook Live. We're gonna be having some practice questions, which is NGN, even one or two questions only. Okay, and that's it. So, everyone, thank you for being here. And I know that for some people who just came in and just watching this video, hopefully that you learned something tonight. So, again, just feel free to email me if you have any questions, or you can put some questions in the comment section and I'll be reading them. And of course, you can visit our website at matusnursingreview.com to see all the programs and the information that we have. And of course, we have Q banks available now for next gen, and also our NCLEX quizzes and the online academy also already have some next generation questions as well. Okay, so thank you very much, everyone, and good night, everybody.